Aurobindo Pharma Foundation is proud of the sustainable impact it has achieved in the lives of lakhs of people. Working in sync with UN SDG goals, it has worked in specific sectors where it can achieve maximum impact that can be sustained on a long-term basis. Each of its initiatives are aimed to meet the felt needs of communities and to improve people's lives. Since 2014, we have spent around Rs 200 crores for education, health and nutrition, water and sanitation, COVID relief, sustainable environment and agriculture, public safety and sports, and other rural development activities in Telangana. While doing so, MNJ Cancer Block at Hyderabad got the attention of Aurobindo to further expand its building's infrastructure through CSR. MNJ Hospital has been running out of the land donated by the first Health Minister of the erstwhile Hyderabad state, Padma Vibhushan Nawab Mehdi Nawaz Jung Bahadur. He had lost his wife to cancer. He realized that there is no treatment center for the disease and donated his personal land to the government for starting the Radium Institute and Cancer Hospital. It formally started operations in the year 1955 when the first Prime Minister of India, Jawaharlal Nehru, inaugurated its operations as a 50-bedded hospital. Popular as MNJ in the memory of its landowner, the institute continually expanded and evolved into a facility with 250 beds. After the bifurcation of the state, Telangana government upgraded it to a 450-bedded hospital. However, due to the increasing incidence of cancer and the growing popularity of MNJ, the hospital is currently housing nearly 1,000 inpatients, which is twice its equipped capacity. Many more patients who need monitoring are being seen as outpatients. Though MNJ has a cure rate much higher than the national average, it is not able to fully share its learnings with global healthcare due to non-access to contemporary specified diagnostics. MNJ is the nodal center in training the health staff of Telangana state in cancer management. MNJ is also hosting many training programs apart from postgraduate courses. Residents of these programs who come here for their unmatched expertise are having to stay in a makeshift room due to lack of space. Nearly 500 outpatients who come to MNJ every day do not have a place to wait, resulting in congestion spilling onto the roads. In this context, when Aurobindo Pharma Foundation was approached for help, its team was seized by the sheer volume of lives being wiped out by the dreaded cancer disease. It was gravitated by the number of more lives that can be saved by adding to the efforts by the state-run MNJ Hospital, which is the premier institute of the state in fighting cancer. Reacting to the gravity of the requirement, Aurobindo immediately put the best experts from various fields onto the job to design a world-class facility in the nearby nursing college land with the dilapidated building. Construction of Aurobindo Oncology block of MNJ was taken up in this location, which is in the heart of the city. Experts were involved in the design stage and various stages of construction. Aurobindo deployed their technical and engineering teams to ensure building a sustainable facility with proper ventilation, illumination and spacious ambience. This facility could be finished in a time frame of 3 years, though COVID caused disruptions. The project monitoring from the day of the foundation stone has been very actively done by the directors of Aurobindo Pharma Foundation, Shri K. Nityananda Reddy Garu, MD and Vice Chairman of Aurobindo Pharma Limited, and Shri P. Sharat Chandra Reddy Garu, Director of Aurobindo Pharma Limited, along with their CSR teams to ensure quality and timely completion of work by regular site visits, and had managed to monitor the whole project personally. The initial efforts to fulfill the objectives of this project by the present Chief Secretary, Srimati A. Shanti Kumari IAS, must be well appreciated. The role of the Director of MNJ Hospital, Dr. N. Jayalata, throughout the project execution has been very instrumental. Beside the senior officials from health and other departments of the government of Telangana, and their constructive advice led to creating the state-of-the-art facility. All care was taken to make it as advanced as possible and all accessible as possible. Everything from ramps to radioactive bunkers were designed with international health standards. Apart from taking care of all design and construction, Aurobindo provided supporting facilities such as ICU beds, oxygen pipelines, oxygen cylinders, apart from furniture in waiting areas and doctor consultation rooms. Aurobindo Oncology block of MNJ is also equipped with fire hydrant, fire alarm, sprinkler and public address systems, HVAC systems, emergency exits, proper power control systems, 1600 kVA transformer and lighting arresters, and required training is given to all MNJ technical, housekeeping and security teams. The new Aurobindo Oncology block of MNJ is a 232,000 square foot, 8-floor building with a footprint spread over 2 acres, which will set new standards in healthcare infrastructure. It's a unique facility unmatched in South India and is designed to have world-class modern facilities. While augmenting MNJ facilities with 300 additional beds, it will also enable an exclusive setup for bone marrow transplantation. Apart from pediatric ward, it will also have an exclusive adolescent ward. The Aurobindo Oncology block of MNJ will have an underground bunker for radiation treatment, which will for the first time enable target radiation customized for the patient rather than a standardized one. It will have advanced molecular labs that will help in utilizing targeted therapy to achieve higher survival rates and lesser toxicities compared to conventional chemotherapy. There is also a provision for starting in-house palliative facilities for the terminally ill cases, which will be a boon for the affected families while giving expert care with dignity for the patient till the very end. Modern facilities will bring in new national and international affiliations. The Aurobindo Oncology block of MNJ will enable MNJ to expand with partnerships, bringing global recognition to Telangana's high success rate. It will also be enabled to check familial occurrence of cancer by identifying the dormant cancer gene, thereby enabling them to have a preventive medicine or prophylactic surgery and thus reducing future cancer numbers. Aurobindo Oncology block will enable advanced research capabilities, thus bringing in better understanding of the disease and thereby better treatments. It will also become a nodal training center for academics and health professionals. The impact of Aurobindo Oncology block of MNJ will not only benefit the patients utilizing its services, but will also support all districts and neighboring states. The research that can be carried out for the institute will help future doctors and will also enable promotion of more awareness among people, thereby reducing future cases. Aurobindo Pharma Foundation has spent rupees 80 crores for the construction of Aurobindo Oncology block and is proud to announce that this state-of-the-art facility is now ready for public use. Aurobindo Pharma Foundation thanks the government of Telangana for giving an opportunity to collaborate in improving the lives of so many people.